Hello and welcome back to Health Hub, your health station, where we together explore accurate and up-to-date medical knowledge to protect the health of ourselves and our families. Dear viewers, stroke. Just mentioning these two words makes many people feel anxious. It is one of the leading causes of death and disability worldwide. Every year, millions of people face this dangerous disease, leaving behind severe sequelae that deeply affect their lives and those around them. We often hear about risk factors like high blood pressure, high cholesterol, diabetes, obesity, smoking. But did you know that sometimes just a very familiar vitamin, found in everyday foods, can play a crucial role in significantly reducing our risk of stroke? Yes, today, at Health Hub, we will together unravel the secret of folic acid, also known as vitamin B9 or folate. A vitamin that might seem important only for pregnant women, but in reality, it is a silent hero protecting our cardiovascular and brain health. We will learn, how does folic acid work to prevent stroke? Why is its deficiency dangerous? And most importantly, what foods are treasures containing folic acid that you should add to your daily diet right away? Furthermore, Health Hub also brings you useful information about another widely researched supportive solution. Let's begin our journey to discover the power of vitamin B9 now. Don't forget to hit the subscribe button for the Health Hub channel and the bell icon so you don't miss out on other beneficial health videos. Before diving deep into the role of folic acid, let's briefly remind ourselves about stroke. Stroke, also known as cerebrovascular accident, occurs when the blood supply to a part of the brain is interrupted or significantly reduced. This deprives brain cells of oxygen and nutrients, and within minutes, brain cells begin to die. The consequences can be very severe, depending on the affected area of the brain and the extent of the damage. From impaired motor skills, difficulty speaking, memory loss, to coma and even death. Stroke not only affects the patient but is also a great burden on families and society. The remarkable thing is, most cases of stroke are completely preventable. By managing risk factors and adopting a healthy lifestyle, we can significantly reduce the likelihood of developing the disease. And today, we will focus on a critically important nutritional aspect in the fight against stroke, that is folic acid. So, what exactly is folic acid? Folic acid, also known by other names like folate or vitamin B9, is one of the 8 essential vitamins belonging to the B group. It plays an extremely important role in many biochemical processes in the body, especially in DNA synthesis and cell division. We often hear a lot about folic acid being associated with pregnancy. That's right, it is absolutely essential for the development of the neural tube in the fetus, helping to prevent serious birth defects. But the role of vitamin B9 doesn't stop there. Medical research has proven that folic acid also has positive effects on the cardiovascular and brain health of adults. It has been shown to help lower blood pressure, a major risk factor for stroke. And significantly, it plays a key role in preventing both brain stroke and myocardial infarction. In cardiovascular and stroke specialty departments in many developed countries like the US, testing blood folic acid levels has become part of the patient's risk factor assessment. From there, doctors can implement more appropriate and effective preventive treatment measures. This demonstrates the importance that modern medicine places on this vitamin. Now, let's dive a little deeper into how folic acid actually protects our blood vessels from stroke. The main mechanism involves a substance called homocysteine. Homocysteine is an amino acid found in our blood. Normally, the body has enzymes to convert homocysteine into other substances that are more beneficial, such as methionine. This conversion process requires the participation of some powerful helpers, including vitamin B9, folic acid, vitamin B12, and vitamin B6. Folic acid acts as a coenzyme for the enzyme methionine synthase, which catalyzes the reaction to transform homocysteine into methionine in the liver. The problem arises when our body is deficient in folic acid, or vitamin B12. vitamin B6. In that case, the conversion process of homocysteine is stalled, leading to abnormally high levels of homocysteine in the blood. And here is the danger. High blood homocysteine levels are a silent destroyer of our blood vessel system. It directly damages the layer of endothelial cells lining the inside of the arteries. Imagine the endothelium as a soft and smooth silk lining that helps blood flow easily. When homocysteine is high, this silk lining becomes rough and coarse. Along with the effects of free radicals and other factors, endothelial damage caused by homocysteine facilitates the faster progression of atherosclerosis. Plaques containing cholesterol, fats, and inflammatory cells begin to accumulate on the walls of the damaged arteries, forming atherosclerotic plaques. These atherosclerotic plaques gradually get larger, narrowing the lumen of the arteries, obstructing blood flow. At the same time, this accumulation also makes the artery walls harder and less elastic. This is the condition of arterial hardening, arteriosclerosis. The consequences of the progressive process of atherosclerosis and arteriosclerosis are increased blood pressure. The heart has to pump harder to push blood through narrowed and stiff vessels. Myocardial ischemia, myocardial infarction. The coronary arteries supplying the heart muscle are narrowed, not providing enough blood and oxygen to the heart muscle. And finally, brain stroke, when atherosclerotic plaques in the carotid or cerebral arteries break off and form a blood clot. Or a blood clot forms in situ, causing sudden blockage of a cerebral blood vessel. Or blood vessels weakened by high blood pressure and hardening rupture, causing hemorrhagic stroke. Conversely, many studies have shown that when we maintain or increase adequate levels of folic acid in the body, especially through diet and possibly supplementation under medical guidance, this helps reduce homocysteine levels in the blood. Consequently, it slows down the process of endothelial damage, limits the formation and development of atherosclerotic plaques, contributing significantly to preventing and reducing the risk of dangerous cardiovascular diseases, including brain stroke. Thus, folic acid is not just a simple vitamin, it is a biochemical factor that plays a direct role in maintaining the health of the blood vessel system, by controlling homocysteine levels. After understanding the importance of folic acid, I'm sure you're eager to know, how can I get enough of this precious vitamin? The good news is, nature has blessed us with many treasures containing folic acid in very familiar and easy to find foods. The first group of foods, and also the most abundant source of folic acid, are dark green leafy vegetables. Think of spinach, kale, broccoli, cauliflower, cabbage, lettuce, romaine. Just 1/2 cup of broccoli, cauliflower, or cabbage can provide about 51 micrograms mcg of folic acid. Or a portion of lettuce or romaine about 80 grams contributes up to 16% of the daily folic acid requirement for the body. But besides folic acid, this group of dark green vegetables is also an excellent source of other vitamins like vitamins A, K, C, along with essential minerals such as manganese, magnesium, calcium, iron, potassium, zinc, and importantly, they are very rich in fiber, which aids digestion, and contain no cholesterol. Add salads, boiled vegetables, or stir-fried vegetables to your daily meals. Next are legumes, lentils, peas, various types of beans like black beans, kidney beans, white beans, soybeans, lima beans, chickpeas, are superstars in providing folic acid. 1 cup of cooked lentils can provide a significant amount of folate, sometimes meeting up to 90% of the daily requirement. Besides folic acid, this food group is also an excellent source of plant-based protein, rich in soluble and insoluble fiber, along with important minerals like iron, magnesium, potassium. Try adding beans to soups, salads, stews, or make vegetarian dishes from beans. A familiar fruit cuisine is also a very abundant source of folic acid. It's winter melon. 1 cup of winter melon can provide up to 15% of the daily folic acid requirement. Winter melon also contains many other B vitamins like B1, B6, niacin, pantothenic acid, along with vitamin C and potassium. Winter melon has a cooling property, often used to cook soups, make refreshing drinks, making it very easy to add to the daily menu. Finally, we cannot forget citrus fruits. These fruits are not only rich in immune-boosting vitamin C, but also contain a relatively high amount of folic acid. A large orange can provide about 15 to 20% of the daily folate requirement. Other fruits in this family like tangerines, grapefruits, lemons also contain a significant amount. Enjoying them directly, squeezing juice, or adding to fruit salads are all excellent ways to supplement folic acid. Additionally, some other foods also contain folic acid such as avocado, sunflower seeds, animal liver, should not be eaten in large quantities due to high cholesterol content, and fortified grains. By diversifying and increasing these types of foods in your daily meals, you are actively building a strong shield to protect your blood vessels from the risk of atherosclerosis and stroke. A proper diet is always the most important foundation. However, in some cases, or to enhance the effectiveness of prevention, using additional natural supportive products is also a worthwhile option to consider. Under the guidance of a healthcare professional, one of the widely known and researched supportive solutions for preventing stroke, particularly due to blood clots, is the use of the enzyme nattokinase. Nattokinase is an enzyme extracted from a traditional Japanese food, natto, which is soybeans fermented with Bacillus subtilis bacteria. The enzyme nattokinase has unique biological properties. It is researched for its ability to help break down fibrin, the main component that forms blood clots. In this way, nattokinase helps support improved circulation and smoother blood flow. Studies suggest that supplementing with nattokinase can support increased blood circulation, support blood pressure control, though it does not replace blood pressure medication. Most importantly, support the prevention of blood clot formation, the main factor causing ischemic stroke, the most common type of stroke, thereby helping to reduce the risk of brain stroke. Not only in prevention, but nattokinase is also researched for its ability to help improve post-stroke sequelae such as paralysis, facial distortion, and memory impairment, helping patients support better functional recovery. At the same time, it also contributes to helping prevent the recurrence of stroke in those who have previously experienced it. So, to prevent and support the improvement of brain stroke most effectively, we need a comprehensive approach. First and most important is maintaining a healthy diet, rich in folic acid from the natural food sources we've discussed. Along with that, eat plenty of green vegetables, fruits, whole grains, limit saturated fats, salt, and sugar. Second, exercise regularly for at least 30 minutes most days of the week. Physical activity helps control weight, blood pressure, and cholesterol. Third, effectively manage other risk factors such as high blood pressure, diabetes, high cholesterol, if you have these conditions. Strictly follow your doctor's treatment plan. Fourth, absolutely do not smoke and limit alcohol consumption as much as possible. And finally, the use of supportive products such as those containing nattokinase can be part of a prevention strategy. But always consult your doctor to ensure safety and suitability for your personal health condition. Stroke prevention is a long journey that requires proactivity and perseverance. By equipping yourself with knowledge and adopting healthy habits, from simply supplementing folic acid through food to exploring other supportive solutions, you are holding the power to protect the health of your brain and heart. In conclusion, folic acid, vitamin B9, is a crucial nutrient not only for fetal development but also an essential factor in protecting blood vessels, reducing homocysteine levels, thereby significantly reducing the risk of stroke and cardiovascular diseases. Enrich your meals with dark leafy greens, legumes, winter melon, and citrus fruits. At the same time, learn about other supportive solutions like nattokinase and always consult your doctor to have the most optimal healthcare plan. We hope this video from Health Hub has brought you useful and practical information. If you have any questions, don't hesitate to leave a comment below. The Health Hub team will try to answer as soon as possible. If you found this video valuable, please help us spread this information to more people by hitting the like button and sharing it with friends and family. And don't forget to hit the subscribe button for the Health Hub channel along with the bell icon so you don't miss new health videos every week. Thank you, everyone, for joining Health Hub today. We wish you abundant health and look forward to seeing you in the next videos.